and they will be answered after the presentation is finished, okay? So now I'd like to introduce our speaker, Mr. Craig Tucker. Craig has been a patent attorney with Eli Lilly and Company for 20 years, where he has been involved in global patent procurement, portfolio management, international IP enforcement, and IP law advocacy. A member of ABPI and AIPLA IP practice in Latin American Committee for 3 years, Craig has been an advocate for the equitable development of IP law in Latin America and globally through various organizations. Craig has a Master's of Biology and Biophysics from Purdue University in 1990 and a JD from Indiana University School of Law, Indianapolis in 1998, and a 6-year experience in bioanalytical assay development. Thank you very much for kindly accept our invitation, Craig. I believe this is a time of very hard work for those working in the pharmaceutical industry. So thank you very much for your time to join us in this webinar. You can start your presentation whenever you're ready, okay?
Okay. Well, thank you very much. So
Craig, can you hear me?
how about that? Is that a
Your
little bit
microphone,
better?
yeah.
Okay.
Yeah.
No, it's working now.
Okay. I apologize. So again, I thank you so much for inviting me, and I appreciate this opportunity to speak about how it is that this COVID situation is impacting the pharmaceutical industry, specifically pharmaceutical patents. And with that, let's jump on into the slides. Let's see if I can assure that I can get the slide presentation going correctly. Okay, I am clicking the share, and it is not allowing me. Okay, so do we have the slideshow presenting? Can someone tell me if they see the slides?
Yes, we can see it.
Okay, great. Very good. And I'm not seeing my own side part then. There we go. Now we're going. Okay, so first off, I need to make sure that it is abundantly clear that the purpose of this presentation is to provide educational and informational content, and it's not intended to provide legal services or advice. These opinions, views, and other statements expressed by me are solely my own, and they are not necessarily representative of those of Eli Lilly and Company, the ABPI, or any other organization. So here we are, COVID, unprecedented times. How many times have you heard that one? How are they unprecedented? It's very much unprecedented advances in medicine and the healthcare systems. Our times are very much unprecedented likewise in the level of global connectedness in so many fields of business and culture. We are unprecedented in these days with the levels of travel connecting larger percentages of the population with both national and international levels with a lot of close exchanges. We are also unprecedented in the levels of public events with regular mass assemblies. Never before in the history of mankind have we been able to put that many people into a soccer field, those many peoples in that frequently into large concerts and other things, churches, other assemblies. People are close together. We are connecting on a much higher level. You put all of those together and you get an unprecedented opportunity to spread an efficient contagion, both nation to nation, but within the nations, penetrating much deeper into the communities. So then we have the COVID epidemic going around the world faster than any other pandemic has affected our world. But it's affected us in another way, and that is where it's unprecedented with our communication systems that virally spread news and information at all levels. On the good side, we get a lot more sharing and easy access to worlds of good information, vetted opinions, good studies that helps us to bring a world to our fingertips. We also, in many good ways, have a huge explosion of viral social media. This can have a flip side to it because it could also spread fear, panic, and misinformation. There's not controls except your own choices of what you choose to hear, how far you vet the opinions, and how much you let others fully vet their viewpoints in a fair debate in the marketplace. So let's start to put this COVID-19 into some perspective. True, for the first time, the globe's been assailed as fast and pervasively by the same life-threatening emergency. True, our faster travel, higher levels of connectivity, and combined with the efficiency of this pathogen, it's outpaced our depth of medical preparedness. Hospitals don't have enough space, don't have enough ventilators for the number of people that are in critical need of breathing assistance. We are running out of personal safety equipment, capacity to resupply. And very interesting and importantly, it's overwhelming what we have become accustomed to expect in our healthcare in many of the developed areas. Well, what about the other side? False. Listening to a lot of these other misinformation, fear, and uninformedness. False that the world's never faced this before. We have. It's also false that the innovative pharmaceutical industry has not ever before risen to newer, higher heights of cooperation and the speed with which we're able to champion and discover, develop, and then effectively deliver therapeutics to the masses. Let's take a look at a little bit of a history of the pandemics. On this chart here, we go back into history as we go on. You see the timelines along here, and you see different plagues or different huge, far-reaching epidemics causing a lot of death and destruction. Of course, everybody spots this big black spot here, the bubonic plague, back in the Middle Ages. We have smallpox spreading over a few centuries. We're going from 200 million deaths in the space of 4 years with the bubonic plague in one estimate. Smallpox over a decade or so, wiping out 50 millions. We come up now to a more modern time, and here we are with today's COVID, representing at this time an early stage in this disease because we still don't have a vaccine or effective treatments, where we are seeing 1/3 of a million deaths in this first 5 months of the year. How does that stack up? Well, it's bigger than the swine flu of a decade ago, and it's Ebola and SARS all put together already. But it pales in relationship to the couple of decades of experience mankind has had with AIDS and HIV, where we're looking at 25 to 35 million deaths worldwide. So this kind of puts it in perspective. We're really not seeing that, and yet we're feeling it so much more, and we're talking about it a lot more too. I want you to note that it is only since about in here that we started having much of an effect of patented, innovative pharmaceutical industry taking on the challenges of pushing the frontiers of medicine and with it, healthcare systems throughout the world. So the history is not that long, but here we are. With that, let's take a brief moment to take a look at an interesting case of polio back in the mid-1900s. To kind of, it's oftentimes presented as the humanitarian no patent zone development and handling of an epidemic. Now, first off, polio had been around for a very long time, ever since the time of the pharaohs. The thing is that in the 1800s and early 1900s, the outbreaks of polio seemed, to our perceptions, to be increasing in virulence and in the impact on our communities. Well, over a course of about 40 years, the development of, in mostly academic institutions, of frontline scientific understanding of vaccines, how they work, how they might be able to be produced, finally came up with breakthroughs in the mid-1950s with the famous Salk and Sabin vaccines. Now, it's often held up that neither Salk nor Sabin patented their inventions on their vaccinations. But let's take a little bit deeper look at the dynamics of the industry at that time and what still happened. With Salk, the Institute actually did look at and closures at around 1950 to 1953, so they felt they would not be able to get a patent in the first place. So it's a little bit iffy, you know, why would you present as if you couldn't when apparently the Institute would have, maybe. Likewise, Sabin, well, when he was trying to get resources to develop and to get the proof of concept for his, Salk was already soaking up most of the patient population in his clinical trials, proving that it could work for a mass vaccination and moving towards eradication of polio in the US. He needed to find other populations, and he went to the Soviet Union. The Soviet Union's government fully funded and sponsored and helped organize mass clinical trials for him to finish developing his. Well, they have an ideological difference there opposed to private rights of any kind. So, of course, they didn't have patents for that one. But notice, even so, both institutes, both groups, kept very tight control of licenses and needed the corporate licenses to enable the large-scale production. It was always under the control and careful selection of the research teams who developed the vaccines. So what can we take home from this view of the polio situation? The originators weren't purposely cut out of the loop, and their livelihoods were already well secured and established based on their institutional positions. Funding for these things also was mostly brought by the March of Dimes, the Rotary Club, and other charitable organizations through much of the world, or by governments who spent heavily to completely fund the development. So let's fast forward now to COVID-19 response. What we know is that it was unheard of before December last year. By the time that 1 month past the reporting of the COVID outbreak to the World Health Organization, 1 month later, it was declared a public health emergency of international concern. 2.5 months afterwards, in mid-March, it was declared the pandemic. But by that time already, less than 4 months from the finding out, identification of a new pathogen, there were already preliminary small-scale clinical trials and the beginning of phase 2 clinical trials on hydroxychloroquine. BioCentury has reported that in May, there were close to 400 potential treatments, not clinical trials being run, but individual treatments, vaccines, and other therapeutics for treating and ameliorating the symptoms of COVID-19. Now let's look at that. Let's step back. You talk about unprecedented, from the identification of a new pathogen to having hundreds of lines of research in 5 months. This is an example of an unprecedented response of an industry. How? How can they do this? Why hasn't it been done before? What we have here is that strong IP systems have created and maintained, here's the word, maintained, a vibrant R&D ecosystem. The IP system has enabled the innovative pharmaceutical companies to work hand in hand with academia, private research institutes like Salk and Seven, and the international research labs such as the NIH, etc. All of these are collaborating with well understood collaboration methods that are based on fairly negotiated licensing of the IP rights. These advanced collaboration licensings affect whole research platform tools as well as the individual compounds, such that what we ended up having is that IP's been the key to they enable that response, because it provided a large pool of early candidates that were already being studied, already had some knowledge, and were held in positions of they could immediately be changed to be focused on, are they useful for COVID? How can we find out? Let's get through these things. Most importantly, you also still had a coordinated, multidisciplinary and brain trust already in place. And that brain trust with the facilities was backed by financial support that could immediately switch to begin working with those systems, those facilities, those personnels to work on the one topic of COVID-19. So the reason that there's so much private industry investment capital available to assure that once they start, then if an individual product proves the safe and effective, there it is. No one starts to build a house before you've already counted the costs to know that you can complete it. You need to be able to have these funding sources, confidence that they can be used and that they won't end up being lost if you end up being successful. They know the risk that they're putting their investment, their resources up to. So you see, they're the enabler. IP rights protected their prior development up to the point that they were, and then with reliance on that IP rights and new IP rights that might come if there is an invention that is made, then you have the experts in place and they are confident in making an investment, knowing what those risks are, and they can manage it and have that whole ecosystem ready to go. Simply put, there's no evidence that IP has been an impediment to the R&D. I think it's evidence that the unprecedented global response, 5 months to have 400 different therapeutic lines being investigated for COVID, is testimony to the system does in fact work. This is the fastest and the broadest response to any disease in the history of mankind. you have to conclude that the IP protection is not a barrier, it is an enabler. Well, let's take a look at patent pools. There's a lot of talk about patent pools. Why not contribute your patents to patent pools? Well, voluntary pools can be useful. They can be of benefit in some instances. And in fact, there's been markets trying to use and have better access to IP of various sorts in various industries. Most of them end up not working so well. You do have the creating of a, but you know, they do have their place, and they certainly aren't bad because they are voluntary. Things that you have to consider on it is that anytime that you create multiple pools for these patents, you then start having competition between them. So some people will go to one. Well, what about all the partners you could have been looking at in another? How much resources do you have to look at 5 of them, 10? So you start losing the in the noise of how many of them do you have. Second point to take a look at is when you lose the contact of the innovators, as you would probably do oftentimes with the patent pools. Well, it's free to open, but then every new partner or new user of that IP has to relearn about the asset, and they lose a lot. There's time and there's resources.
Craig, you have to unmute your microphone. We are not hearing you.
My phone is unmuted. I don't, it says it's unmuted. Can you hear me now?
Yes.
Okay, so is that any better?
It's okay now.
Somebody say something. I'm
It
wondering if
is
there's
okay. It is okay now.
It is okay. I'm sorry. Okay.
But
let me get back to my slides. Okay. So
we don't see the slides. I think you have to share again. Something happened.
okay. Is it working now?
Yes, it's working now.
Okay, great. Very good. Okay. Are we following? Is it tracking okay?
Yes.
All right. So moving along then, the third thing that you have to keep in mind with a new patent pool is that creating any infrastructure for the new patent pools, well, that requires significant resources in people, capital, and time. And when you're trying to respond to a something like COVID, a present public emergency, health and epidemic, time is of the essence. People are perishing in that time. What do? Well, the current industry responses, I think, proves that generally maybe they're not needed so much, or they would be redundant with already existing mechanisms of collaboration, which are clearly working. So to be truly useful, any licensing mechanism, you need to be sure that it is voluntary in nature, because if you have any elements of compulsion, well, the risk of undermining that collaboration grows exponentially. In order for partners to be able to freely share, openly give whatever they have to understand what they are offering up and where they, what their limitations are. And that happens when you have strong IP and it's voluntary. The second thing, you need to use one of the existing mechanisms already so that you don't lose time, energy, or distraction. The element of distraction is a major disruptor, not an enhancer of the efforts. You need to ensure that you've got close consultation with the industry. Don't cut the innovators out, because they're the ones that have the expertise to be able to transfer, to be able to scale up, and to make the best use. That's what Sabin did. They kept control of the progress as it was scaled up by industry. Okay, and then lastly, it needs to be able to be flexible and adapt when you have unique challenges coming in. Each new pandemic, and there will be more, they have different characteristics, different needs. When any one of these licensing mechanisms needs to have the flexibility to adapt. So as the current industry response proves it, they're generally not, new pools aren't generally needed, and that they would be redundant to the existing mechanisms, which are working amazingly well. So what about once the treatment's found? That seems to be one of the key touch points of fear, distrust, and concern for many people. Well, it's strong IP rights actually are the things that allow for the parallel investment towards the scale up of manufacturing that's going to be necessary to finish the development, get the registrations, and start supplying the market as fast as possible. The coordination under the secure IP rights will enable the most efficient global supply also. When you have many actors acting on their own, acting in discord, well, you don't get as efficient use of the scarce resources that you have, particularly when you have a lot of shots on goal through different opportunities, different therapeutic lines. You need to be able to know, okay, I can supply. And if I need more help, I can license to make sure that the quality stays the same, quality stays high. And very importantly, what about early aftermarket surveillance? It's very important as you roll out from your clinical trial populations to the real life populations around the world. You need to be able to monitor that. And the industrial innovative pharmaceuticals companies know how to do that, how to manage that on a global level already. When you divide it up, the left hand doesn't necessarily know what the right hand is doing, and you lose this very important role of post-market surveillance. So generally, the innovative industries already been working closely together with the governments. They're already in communications. Now, one of the things that I've become keenly aware of myself is that we're ethically bound not to talk about or push things that haven't already been proven scientifically. We can't go to a government and say, hey, don't worry, we're going to be able to supply the market here, 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 and let's talk about this, because it's not approved. It's a non-approved use. You get in trouble with that. That's unethical. You've got to stick to what approved labels are. You have to talk confidentially as the developments happen, as you have proof, and that only happens at the end, not at the beginning. So everybody can have a lot of fear about what hasn't even happened yet. You can generate a lot of concern when you don't even have a therapeutic yet. You can overpromise, and then when you don't deliver, now you have a real problem. So next topic, let's talk about compulsory licensing for a while. So it's important to know that when people are talking about emergency compulsory licensing and, oh, we got to do this, we got to do that, we have to change the laws, it's important to realize that every member of the World Trade Organization, they already have a basic IP law in place. They're obligated to TRIPS, and it already has the exceptions for compulsory licensing of any sort. They can provide for limited exceptions that, importantly, do not unreasonably conflict with a normal exploitation of the patent. They don't unreasonably prejudice the legitimate interests of the patent. Let's go back to polio vaccine again. They didn't cut out the innovators. So with that, and with the assurances that you're going to have the minimum levels of patent rights, that you could step in for certain reasons, they put boundaries. So in the original TRIPS, you had Article 31A through L put the bounds of compulsory license. Number one, individual merits. You take it patent by patent by patent. The intellectual property right that is granted. Is there a problem? Do you need an exception for an emergency, say? Then you might do it. You have to take it a patent by a patent, not a blanket. Second obligation, you have to have a prior effort to negotiate, but notice, it may be waived, as everyone already has in their law so to do, that the member can, for emergencies, waive the pre-negotiation, but you have to give them notice still that it's happening. And you have to, in all cases, give adequate remuneration, not token remuneration, not cut the innovator out, because that unreasonably interferes with the normal exploitation of the patent rights. And in the circumstances of each case, not a one-size-fits-all remuneration, which is token, not adequate. And you're obligated to take into account the economic value of the innovation. Some more, some less. One size does not fit all. Sometimes there is a lot of public investment. Sometimes there's a 1% public investment and a 90%, 99% per individual private company investment. They should have different remunerations, would be adequate. They would have a reflection of a different economic value back to the patent holder. And the last thing, which needs that's and is in every country's laws already, is subject to judicial review when there is a different agreement about the validity of the authorization or the decision on how much remuneration. So with these, that was back in 1990. Fast forward 10 years, and now we're in the middle of the HIV/AIDS epidemic, the first global epidemic that people are trying to scramble for new innovation to how to stop it, how to deal with it. So with that, the activists also got into the Doha Declaration to make sure that patents weren't going to be the barrier, patents weren't going to be in the way. Again, everybody's fear mongering. So what does the Doha actually do? It recognizes, yes, emergencies and epidemics are important. They're very grave matters. And the TRIPS understands that. The TRIPS agreement understands that. It stressed that the need for their IP was there, just like in TRIPS. That was the whole point of it. It recognized the importance of developing new medicines. Without the IP, you're going to really slow that down. It also recognized concerns for everybody's favorite thing, the moose on the table, the elephant in the room, prices. Next, it said, we're going to make sure everybody understands TRIPS is supportive of the members' rights to protect the public health, have access to medicines for all, and we're going to interpret it flexibly so that each member has the right to grant compulsory license and the freedom to determine the grounds upon which such licenses are granted. And guess what? Every country has almost parrots this language in their compulsory licensing. They have determined the grounds upon which to do compulsory licensing, and it's in their compulsory licensing law. Generally, you don't really need to alter what those are. So we're moving along here. I'm trying to pick up some speed now. So let's take a quick look at what has occurred in response to the COVID-19 activist opportunism. Everyone they call out their concern that there will be opportunistic innovators, well, what about the opportunistic activists? Because what we actually have is the same agenda, the same arguments, the same asks and pushing for what ultimately is an ideological difference of should there be patents on pharmaceuticals? Does it help the innovation level? Does it help generally to bring countries up? And there's many studies that show that yes, intellectual property rights do bring an entire society up, an entire nation up if they are there and if they're enforced, and it helps develop everything. So we have here, and I think most of you are probably already aware of this list of um, um, opportunities of efforts to move on advanced compulsory licensing throughout the world in response to COVID-19. Canada enacted emergency provisions that streamlined the process so that it cuts out a lot of the process to authorize when a compulsory license is deemed to be needed to get it in place quickly. The Germans did the same, but they kind of did it in an authorization of government procurement. Where the government, we have an emergency, thank you for this very much. We will adequately compensate you for it, and away you go to use it. Israel is the one and only example so far with a compulsory license to Kaletra from AbbVie. After they talked to AbbVie about their current drug for AIDS that might be useful for COVID, while AbbVie was investigating its suitability for treatment of COVID, and AbbVie said, look, we won't be able to scale up. We're not willing. We're just not in a position to supply a COVID market with it. At least that was the point at that time before they even got very far into the clinical trials. Well, Israel took that and said, fine, we're going to compulsory license it to make sure that if you end up having it approved, we will have a full supply of the market. What about Latin America? Latin America, we've got Chile, Ecuador, Colombia, Costa Rican efforts, and the Brazilian legislative efforts that you know very well. I'm not going to go through each one of these, but I am going to summarize that all of these are mostly just facilitating the process to let the current compulsory licensing work faster. So it isn't a blanket compulsory license to everything. It might kind of sound like it, but what you actually find is that it ends up just deeming the emergency. Therefore, you don't have to ask and prove that it's an emergency situation, that we can bypass the negotiation if we have to, but we should still take a look, because the best, fastest way to supply the market is if the innovator probably already has it in their mind of how they're going to do that. Will they be able to do that? And the way that the Doha thing, the way that TRIPS was designed, was to give the nations the ability that if the innovator couldn't or somehow wouldn't, then they can take care of themselves. It wasn't meant to cut them out or to give them a token piece of being able to do what they do best, and that is once they find it, deliver it. So now we do have then slight difference. The goals of the Chilean and the Brazilian proposals that are in the Pharmacos 2 and in the current 1462 public law provision, they do more than just respond to the identified emergency. The identified emergency provisions are already in the Chilean and the Brazilian code of how to handle those. They already have the full authority to do so. What they would like to do is change the balance of the law permanently. And you end up being able to cut that patentee out at any time that you want to declare, or somebody else in the world declares a public emergency, under the fear that it won't be, or maybe it's for other reasons, based on different philosophies and being couched as if for the concern that the innovator isn't going to be able to do it. So let's summarize here. The most of the actions facilitated processes for their current compulsory licensing to work faster. They weren't blankets. They didn't intend to use the patentee appears able to supply the market. And I've already kind of gone through these, so I'm going to skip ahead. And I'm going to conclude with these two slides, and that is how has COVID impacted the pharmaceutical patent? In truth, it's kind of boiling down to another day in a very long battle. We have activists continuing to press that same long-standing ideological agenda that doesn't allow, in my opinion, for the realities of a sustainable pharmaceutical R&D ecosystem that has produced tremendous benefit and advancement of medicines for the entire world, and has had an unprecedented response in just this first 5 months of the COVID pandemic. Second, the innovation pharmaceutical industry continues to progress and advance the medical science and to address the healthcare needs of the world, focusing on what they do best. So the industry itself is still focused on the patient, focused on the disease. How do we fix this problem? Then, in the face of this current pandemic, well, rather than distract, maybe it'd be better, to distract measures to reinvent, or maybe it's dismantle the IP system, but rather to focus and observe that we've delivered unprecedented innovation. Governments and industries are already working tightly together, and the industry has already publicly indicated that they will assure that we've committed to supplying the market, supplying it affordably, supplying it efficiently across the globe. Let's then focus instead on these clear areas where we can facilitate a rapid response, quicker access, lower prices. We can get regulatory approval optimization, not just a slipstream rubber stamp, because it has an important role to play in making sure the data does in fact say, and you have an independent verification, yes, we think it does say it's safe, it's effective for this indication. We need to remove the unnecessary supply chain barriers. We need to not be having export bans and things like that getting in the way of what is already a global supply chain. That would be a benefit. We need rational allocation strategies rather than unrational stockpiling, just to be sure you have enough within your own country to supply the whole world. Let's make it reasonable, then everybody gets what they need. And lastly, let's remove taxes and tariffs so that immediately reduces the cost for everybody. And with that, I have a whole set of backup slides we can go to look at each of those individual provisions, but I'd like to just go ahead and move to the questions maybe.
Okay, thank you very much, Craig. I want to congratulate you on the excellent quality of your presentation. It was a very clear explanation on key points for the current global situation in terms of IP rights. I just would like to make a specific comment on compulsory licenses. You were able to put things together in such a way that you could show that patents are not the enemy, but the opposite, right? So by having a strong IP system, the countries can handle the whole situation with legal security. So thank you very much. If you do not have any comments on this, I would like to open for questions, okay? Actually, the first
I think I
question,
might say just one kind of a blanket statement of my personal philosophy. My personal philosophy is that there's lots of tools, and everybody knows them, of working to make things more affordable, making them accessible, and also making sure that the funding flows back to cover costs of not just what went into that drug, but supplying the need for the next generation of innovation. That's what the key is, to have sustainable growth. But if you let strong IP do its role as it's designed to do, and then use those other ones to get at your concerns about cost, your concerns about other barriers to access, then you will not end up having one side muddled over the top of the other. Let the patent law be the patent law and do what it does. Then you have legal certainty, you have less chaos and confusion, and the system will work, and you can find good solutions to those other concerns. That's my blanket statement.
yeah, thank you so much. That was very nice summary. So can we now move to the questions? Start questions.
Absolutely.
Actually, the first question comes from one of our coordinators, Ms. Ludmila Kawakami. So, Ludmila, could you please make your question?
Hi, sure. First of all, Craig, thank you very much for a brilliant presentation. And I will just jump on to a question. So, as you may be aware, the Brazilian Patent Office has a program for expediting examination of applications related to technologies that are considered of interest of the Brazilian Unified Health System. And recently, the Ministry of Health requested the priority examination of patent applications related to remdesivir, tocilizumab, serilimumab, and favipiravir. Looking from the perspective of the global pharmaceutical market and for the fact that such medicines are being tested for COVID-19, how do you see this kind of initiative? I think you're muted, Craig.
Can you hear me now?
Yes, yes, perfectly. Thank you.
Okay, sorry. So I think it's great anytime a patent office can facilitate the legitimate, good quality review of a patent so that you get a patent that adheres to the patent law, novel, inventive, industrial applicable, it's specified well. That's good. Now the question kind of comes up with, and it's a great goal that here they're very important. So if you have them secured, a pharmaceutical company is going to have a much better view of making sure that a normal everyday, there's never an everyday, but a therapeutic becomes available in a market when there is intellectual property protecting it, so that you can invest to get it up and running, because that takes time, that takes resources to get it out, have people learn how to use it, all of that. So getting the patent is great. Now, is there an ulterior motive going on in relation to it, particularly in view of the compulsory licensing amendment bill sitting there, that we want to get the patent granted so we can slap it with a compulsory license and get Joe over here to produce it for us, and thank you very much, bye-bye? That would be very detrimental, because, and so you can imagine that the industry could be anxious if, you know, we got the idea that that was the ulterior motive, the true motive behind the concern to get the patents through. The whole process, patents, registration, approval, importing, setting up the supply chains, how to distribute it to the poor neighborhoods, not just the rich neighborhoods in that country. That's all great concern, and anything you can do to break down those barriers that's good. When, you know, so there's my answer.
Okay, thank you, Craig. I think we have another question. Just a minute here. Mr. Alex Almeida is gonna make a question. Maybe it's a good idea if I read the questions, right? So that we do not have to open for everybody to speak. Just a second. So the question is about this collaborative environment that now has started since the outbreak of the pandemic. So how do you see the collaboration between not only innovative pharmaceutical companies, but also with universities and research centers? So what is your opinion on this new era of innovative collaboration, much stronger than ever?
I think it's fabulous. It's an amazing thing. It's as the costs of pharmaceutical development continue to go up, the days of being a innovative company that has a huge research base to ferret out disease targets and characterize them and see how they work in the physiology, and work on creating chemical entities that might modulate that. How does it modulate? Studying everything about that, and be expert in developing a clinical trial program and executing excellently on that, and knowing how to register your data package for every country throughout the world, and how to manufacture that in scale up around the world with some global supply chains, and get it out to the retailers. That those days are you know, it's very difficult. That is a very expensive way to do it if you can focus on one niche of it. And that's where all of this diversification of including research institutes, academia, small companies, startup companies, ones that will take a first clinical trial phase 1 asset and then prioritize it and expertly take it up to the beginning of phase 3, and then passing it on to another company who is more adept, has greater expertise. This is the way that it has started. Intellectual property rights are what is that's the ownership. And the ownership is control of how the asset is managed. And with being able to clearly understand what those rights are, being able to negotiate who is doing what with it, and add each piece can do their expert piece of adding value to the chain until you have a global success. So I think that last ABPI annual Congress, there was a great presentation in what was actually my panel, of a study done on the collaboration and the need for continued collaboration between academia, which is great at getting at that basic science, what we call pre-commercial space. Then when that's understood, well, then the innovative big pharma can get their masses in charge of what they're good at, generating a whole bunch of molecules, testing them out in large scale and getting them to clinical trial. So it works great.
Okay, great, thank you. I just received a message from the organization of this webinar, and it seems there is a member of our association that wishes to make a question. So please, if the host can put this person can open the camera.
Hello, hi. Are you hearing me, Gabriela?
Yes.
I am hearing you.
Hi. Hello, I'm Gustavo Moraes. Craig, thank you very much for your brilliant presentation. I'm sure that I will request
You are too kind. You are
your
very much too
slides.
kind, and thank you.
Greg is one of those IP connoisseurs that knows about IP not only in the US, but in diverse jurisdictions like in Brazil. And as you know, Craig, on top of these movements regarding compulsory licensing in Brazil, the Ministry of Health requesting acceleration of some patent applications, we also have the revival, if you will, of these ADI 5529, the constitutional challenge against the sole paragraph of Article 4. As you know, in Brazil, we have this odd provision that a patent will last for 20 years from filing or 10 years from grant, whichever expires later. And the idea of this constitutional challenge is to declare against the Constitution this sole paragraph. So if this lawsuit, if you will, is successful, in the end of the day, in an extreme decision, we may have an impact on more than 30,000 granted patents in Brazil that have a term of 10 years from grants. I know that this may be a difficult question, but how you believe that it would be the reaction of originators like your company?
Mm-hmm. Well, first off, I'd like to say that it's not such an odd provision. It's not odd at all. And in fact, in the United States, up until not that long ago, maybe I'm dating myself, I don't know, but the patent term wasn't 20 years from filing. The patent term was 17 years from grant, because you didn't know how long it was going to take to get it out, and you can't use it until it's granted. So what good is a patent, an invention, if you don't have the patent granted? It was 17 years, surefire. You knew exactly how long of a term you had to be able to use and profit from your invention for the tit for tat, the benefit of providing the public with your information of how to do your invention displayed in the patent application. That was the trade-off. I disclose my secrets, how I do my invention. It stays for posterity and doesn't die with me if I don't tell somebody else. I get, therefore, exclusive rights for a period of time. How long? 17 years. 20 years from the date of filing, it's dependent upon the government. How long does it take them to examine the patent? If it takes them a couple of years, well, you're getting right down there to the 17 years again. And that was the theory behind the 20 years. But what happens if, for whatever reason, it takes 10 years, 12 years, 15, 16 years? You have a patent that was supposed to be useful for 20 years, and now you have something 16 years later. You should have been marketing that. And incidentally, everybody else can be marketing it too. But now you've got 4 years instead of 20 years. In the United States, we have this concept of freedom, property rights. The government can't take your property right without paying for it. And they can only take it under eminent domain. There is a strong, compelling reason the government has to use your personal property, which includes intellectual property. So this 10 years from the date of grant was a simple and very reasonable trade-off for the government not being able to effectively get Brazilian patents granted. It was taking too long. It was not effective. And so, whereas in most of the world, it takes, from 3, 4, 5 years to grant a patent at the most. And if it takes longer than 3 years or so, you get patent term adjustment. They will add on after the end of it so that you're compensated for your loss of the right to be able to use your patent. So in Brazil, rather than having a patent term adjusted for the amount of time taken, they just say blanket, you get 20 years, or at least if we take too long, we're sorry, at least you're going to get 10 years. So it was a just compensation for it. So it's very much in keeping with the same theories that almost, most of the other countries, and certainly all of the more countries with robust innovation, particularly a robust pharmaceutical innovation, they already have patent term adjustment and patent term extension when the regulatory authority takes too long to give you your approval once you submitted your data package to request approval for a new drug. You get patent term added on so that you can exploit when it's exploitable. So I think that if Brazil did find this term unconstitutional, that's unfathomable. You're supposed to get a patent right. The government's not supposed to take it away or minimize it because it frittered away, died in prosecution, pointing out no fault of the patentee, not playing games. We got to avoid gamesmanship, and there's ways to do that in the law as well. But so this is it, and this would be a very bad turn, a very bad signal that patent rights aren't worth anything in Brazil. That would then say, yeah, think twice before you take it in there, because someone's just going to take it from you. Are you able to do it, use it in Brazil under those terms? If not, don't go there. Sorry, we can't afford to. It doesn't work. So if that would happen, now on the flip side, on the practical side, Brazil has done wonderful things in reducing the backlog. My hat is off. I tip my hat to INPI for the great job that they are doing in reducing that backlog, so that hopefully every patent is certainly going to take much less, than 10 years, hopefully less than 5 years to grant, and it should. They're capable people. They're good folks. They're hardworking folks. It should be able to be done. And so hopefully there would never be an instance where it would take an incredible 10 years or more. The only other country I know that has that long of tenure of patent examination is Argentina. And, so that's a different story, but it is a story nonetheless. So yeah, I think it would be a bad signal and difficult. Why do that? When you also have compulsory licensing, if the market is not being served by the patentee, you can compulsory license that. So, hurry up, get the patents granted. And if it takes you too long, 10 years is fair. Thank you.
Okay, thank you very much, Craig, for your explanation on this. Thank you, Gustavo. It seems that we have one more question. I'm trying to see if the person will make the question, actually, because just said hello, but there's no question. Yeah, there's no question. So if we do not have additional questions, and before giving the floor to ABPI's president for closing this webinar, I would like to once again thank Craig for your brilliant presentation and the audience that attended this webinar. I hope you have enjoyed it. I think I have the members of the Biotech Committee here as well. No?
Again, I thank you, and I hope that my comments and my thoughts are thought-provoking and create a lot of dialogue. Dialogue is the key. When we start listening to one another, and in truth, listening to one another, then everyone's needs can be met. Let's do that. Yeah, that's right. That's right. Well, thank you very much, Craig. Now I'll give the floor to ABPI's president for closing this webinar.
Thank you, Gabriela. Thank you very much, Craig. Craig is a great, as for the ones who do not know this, Craig is a great supporter of ABPI and has been helping us for the last years, speaking and participating in all ABPI's seminars and annual congress. And before closing our webinar, I would like to make one comment and one announcement. The comment is important for all of you to know, and also for Craig, is that ABPI is conducting a lot of efforts with the Brazilian Congress in order to clarify that we have a provision in our patent law in place regarding the compulsory licensing, which is quite good and does not need any modification and any other new law for that. So this is a difficult task because almost every day there is a new bill in place at the Brazilian Congress regarding the same issue with small differences between each other. And what I would like to announce is that ABPI is about to finalize the organization of a contest for the patent of the year in relation to the COVID treatment or vaccine or medicaments. So we are about to announce that officially, what is probably going to happen next week. But and the Brazilian Patent Office is with us on this task, and the Academy of the Brazilian PTO is the one who will be judging who will be the inventor of the year. So this is to be announced shortly. And I would like again to thank everybody, our group at ABPI and Craig again, and hope to see you all in a next opportunity. Keep safe, and thank you very much.
Thank you. Keep in touch.
Thank you. Bye.
Bye.
Bye-bye.
Bye, thank you, Greg.
I
Thank you, Craig.